evening, and welcome to another edition of the Rankin Mon Valley Pittsburgh section of the National Council of Negro Women. My name is Patricia Blewett, and I am the section's corresponding secretary. And joining me today will be a member of our political committee, Miss Alice Paylor Days. We'd like to thank all of you for participating in our previous programs, and we hope that you will join us today by calling in. And that number to call is 412 953 9583. And that number will remain at the bottom of the screen for you. Our special guest this evening is Dr. William Simmons, who will again help us to discuss the COVID 19 and the vaccination and the updates. This program satisfies two of our national mandates to disseminate information about issues affecting African American women and their families, as well as promoting healthy lifestyles and behaviors through wellness programs and projects. It also satisfies one of our Four for the Future initiatives, which is to continue National Council of Negro Women historical focus on health concerns in the African American community. Alice, are you able to join us? Well, Alice would have told you. For those who have not seen our previous shows with Dr. Simmons, we will introduce our special guest by reading his brief biography. Now, Dr. Simmons, William Simmons, is MD, is an associate professor at the University of Pittsburgh School of Medicine. He is originally from the state of South Carolina and was the first in his family to attend college, medical school, and study abroad. Dr. Simmons earned his BA at Carleton College in Northfield, Minnesota. He was the only African American male involved in the third ever Mayo Clinic Medical School graduating class. He was the first Black chief resident in pediatrics at Georgetown University Hospital. Throughout his career, he has been a teacher and a groundbreaker in the medical field of excellence. This year, Dr. Simmons was chosen by the New Pittsburgh Courier as one of the Men of Excellence, which is an award to those who extremely exemplify strength by standing firm in the face of adversity, leadership in periods of struggle, and compassion in times of peril, and integrity in the midst of opposition. Welcome, Dr. Simmons, and we thank you for appearing on our program again. We have been presenting programs on COVID and COVID vaccination on a quarterly basis, and we would like to continue going on with our viewers. So, welcome to the show this evening.
Thank you very much for having me as a guest. Thank you.
Thank you. Okay, so we'll start with the questions, and at any time, just jump in with additional information. I believe Alice will be joining us eventually, but we'll just start without her right now. Okay? Do you think that the hesitancy about taking the vaccination today has changed much? And for those who are afraid that they may have adverse reactions to the vaccination, are the doctors better prepared for what may occur?
There is still a great degree of hesitancy on the vaccines and the use of the vaccines, and that's why people are still being encouraged to do so. That hesitancy is also amplified by the parents. Many times, the kids up down to 5 years of age. There's a vaccine that can be used for the 5 to 12 years of age, and then from 12 to 18 and so forth, and then adults. But very few, especially in the African American community, young people are actually getting the vaccine, and that is because of the hesitancy associated by their parents.
Okay.
Even if they've gotten it themselves, they still not sure if they want to give it to their child.
What would your advice be to them?
That is a a significant question that you just asked. I don't, the 5 years of age and under definitely don't need a vaccine. The oftentimes the viral process in the younger kids are not nearly as significant a problem as it is in adults in many cases. And there's also a fair amount of concern about reactions to the vaccine itself. And so that's why I say I'm not going to give an answer that says, oh, carte blanche. There are some concerns associated with the vaccines, but I would say for the most part, to protect your child that going to school in a large environment where there might be other kids that are and teachers and so forth, you definitely may want to have them vaccinated so that they not bring something home to the elderly people that are in their families, that they might be able to have at least some protection. And this is a fallacy. People think that once you get the vaccine that you are unable to get COVID. The term is that it gives you it reduces the severity of disease. And that does not mean that you can't get it, but it means that you, by getting the vaccine, your course would be significantly less for the most part by getting that vaccine. But it does not say that you will not be able to get COVID once you got the vaccines.
Okay. What about the data? Is there any data on people dying due to receiving the vaccination? And before you start, there's Alice. Hi, Alice.
Hi.
Welcome. Well, Alice, I just did your question, so we're going to have Dr. Simmons answer it, and then we can
Oh, yeah,
on to
go
that.
ahead. That's fine.
Okay, great.
First of all, I wanted to say that in the United States, there are 84.5 million cases of COVID that have been documented during the course of this last few years, and 1 million deaths from COVID has that landmark of 1 million deaths has occurred. So it is a very, very serious problem, and many of your listeners and families have been affected by this, where you've had someone who has had the disease and who has died. There's also another, the CDC is also keeping another list, and this is Vaccine Adverse Event Reporting System. This is a list that where physicians, medical people from all over the country will send in a report of what they perceive as a reaction that has occurred from someone who has taken the shot. And there are 1,200,000 different reports that have been put into that list as of May 20th, 2002. And there are 28,312 deaths on that list. But most of the time, it is hospitalization or someone having to go to urgent care. People who get the shot sometimes can have some inflammation and swelling in their arms, or viral or temperature and so forth. One of the things that is very significant is that there are 13,000 people that have reported to have after getting the shots had shingles, and I actually I'm one of the people that had shingles after having my vaccination shot. But that is something that also once you've gone through the process, you can get a vaccine for the shingles so that it doesn't become a recurrent problem for you.
Okay. Did you get the shingles right away, or was there a period of time between the vaccination and the shingles?
It can be a period of time after you've gotten the shot, where you start where all of a sudden you start feeling that the characteristic stinging pain. It goes dermatome. Dermatomes are kind of like a band that goes around the body from back to the side, or sometimes it can occur in the head or other places in the body, affecting your even affecting your face or eyes. But the thing is that there are severe allergic reactions, and there are also uh, myocardial heart problems. You heard about this happening to kids, particularly where they can have myocardial or pericarditis and heart problems and so forth. So they're beginning to release those kinds of information. Initially, when we were getting the vaccine, they weren't talking much about potential complications associated with vaccines, but now they have become more open to just expose those lists that they've been keeping in regards to potential problems. And that's not to dissuade you from taking the shot, because you can look at the list of potential problems of taking aspirin. At least they were more open with those, because those are written on the bottles. Those are written on every kind of
Right.
medicine that you're taking. Now with the vaccine, they're just letting you know that indeed there are some people that, quote unquote, report that they are having some potential problems after having the vaccine.
Okay.
Is there any part of the United States that the disease is more prevalent?
Um, in Of that 1 million deaths or 84 million cases, the number one state for having COVID is California. They've had 9,600,000 cases
Oh,
and 91,000 deaths. Texas is number two with 6.8 million cases and 88,000 deaths. Florida is another 6,100,000 cases and 74,000, and New York is fourth on that list with 5.4 million cases and 68,000 deaths. Further down the list is Pennsylvania, where they've had 2.9 million cases and 45,000 deaths associated with COVID. So every state has been affected, but as I mentioned, the top four: California, Texas, Florida, and then New York. Those are the ones that are most prominent.
is it more prevalent in a certain age bracket, or male or female? What do those numbers look like?
Oftentimes the numbers aren't breaking down in male or female, so I can't really give you an assessment on that. I do know that people who are immunosuppressed, people who have significant medical problems that have made them more vulnerable, diabetes, heart disease, those kinds of people can indeed, when they get it, they tend to have a bigger course. As the initial kinds of COVIDs that have been out there and getting back into the original, and then the Delta, and then you got to the Omicron, and now we have versions of the Omicron that's causing problems like that. The original had significant problems with death. These new ones that are coming out right now, which is the variations on Omicron, I don't know, they are the ones that just have mild cold-like symptoms and subclinical vasculitis, and you might have some significant amount of coughing, but they can cause lung concerns and abdominal concerns. People may think that they have a so-called stomach flu or a problem like that, and that can but the symptoms are much milder now. So a person can go through and have an episode of COVID and not even know that they're having a problem, and not go and get even checked out, because it's just mild stomach problems, may have some nasal burning, they may have some mild cold symptoms, and because they're not as aggressive, people aren't they're not being treated aggressively, they're not being put in a hospital, they're not getting the various kinds of treatment that they were giving before, gamma globulin and so forth. They're not giving those kinds. For this is a much milder the kind of Omicron variants that are out right now. It's much, much milder, and but still can cause you problems, and still of significance, and still means that you going into a crowd, you need to wear your mask, and you need to take precautions, especially in African Americans have had a significant effect because we have chronic illnesses. We have the diabetes, the high blood pressure, the heart disease, and all of these things. And because of that, we are more vulnerable. Many times our immune system, which works on needing vitamin D as a major part for the immune system to work well, African Americans are significantly deficient in vitamin D, and so because of that, it has been at least in some of the research that have been done that might have been one of the leading cause as to why people who are African Americans that get the disease can have more severe consequences from it because we don't have a strong immune system because of the lack of various things like vitamin D in our system.
Now, what if you get the COVID vaccination, and you have COVID, but you didn't realize it at the time? Are there any adverse effects? And why don't they test before they give the people a shot?
Many times there wouldn't be any major consequences for getting COVID. If they know for a fact that you have COVID, they may wait for the prerequisite 5 days of isolation and then give you the shot. But if they don't know, we've not seen any major consequences for people who have had shot given during a time that they may have had a subclinical case of COVID. If you go to a testing place and you are actively showing signs where you might have a fever and you might have be coughing, shortness of breath, you might show definite signs, then they will send you off for testing and then find out if you have COVID. But if you have these mild symptoms that really doesn't amount to significantly, many people indeed have gone ahead and not known it and gotten the shot without any consequences.
Okay, thank you.
Now, should a pregnant woman receive the vaccine? And if so, what effect could that have on the baby?
There are significant questions about that. There are some people who are in the know that are obstetricians and so forth. That's not my field. That have some concerns about anything. As an anesthesiologist in critical care, we have limitations on what we will do for people who are pregnant. Some of the inhalational gases that we use have dire consequences in that first trimester. That's why we won't use nitrous oxide. We won't use certain things in that, because that is when the child is being essentially knitted together, and it is likelihood that some anesthetic can cause problems and for that newborn baby in its formation. But that is not necessarily considered a negative. There will be people who are pregnant will go ahead and get the shot and not have any consequences, at least that we know of. But I would say the vast majority will kind of hold back on giving it to a pregnant woman, because you really don't know all of the consequences that would do for a person.
Okay. Now, some of us have received 2 vaccinations, a booster shot. Some people have even received a 4th vaccination, and some a second booster. How many shots are we going to have to get, and do we have to get them every 6 months?
That the information is still out on that. We're still getting the COVID shot is still the original COVID shot that we got. And it was truly manufactured and designed for the original version of COVID.
Mhm.
As you know, we have had multiple different variations on COVID, and that variations have a different protein coat on the outside, which means that the percentage of effectiveness that we have been told on the original shot for the original version is significantly different as you go on to the deltas and the Omicron, and then going on to the Omicron dot 2 and the Omicron dot 4 and the various different sub variations on Omicron. Each one of them are structurally different, and because we are the shot is focused at the first version, it may not have the same effectiveness as it did on the original. So that is something that has to be taken into consideration. That's why oftentimes they're asking you for additional shots to try to boost up your immune system so that you can indeed fend off some of these newer versions or variants that are coming along. But recognize that one, even though you get the shot, you can still get COVID. And but the likelihood is that it's not going to be as severe as it would be if you did not have any kind of coverage or protection whatsoever. And as we go on to more and more variants, they would probably want to continue to boost up your immune system so that you might be able to fight off any variants that is coming along.
So are you saying that we should continue to get shots as they come out, or?
Yes, that you more than likely you will have to, and eventually they will start making vaccines that are more tailored at whatever variety of COVID that might be going on at the time, because new research is constantly being done, trying to look at different areas that are non-changing on the COVID structure, and by getting a variant, getting a vaccine that is tailored to an area that doesn't change on the COVID molecule means that you may only have to get that one shot, because any other form that occurs in the future will also be effectively treated by that one. That is still something that is yet in the making. We don't have that one that all encompassing, all inclusive shot yet, but that's where some of the research is. And definitely when that comes along, that would definitely be one that you really want to take.
So with children, what is the age bracket that children should first start getting the shots?
Pfizer has made a shot that it goes down to age 5, and that first shot is from 5 to about 11 to 12. And then there is a different variation, which means a different dose concentration that goes on from 11 to about 18. And then there's the adult shot. So there is reports and research that's done that you can have effective coverage for children down to the age of 5. The likelihood of there being a shot that is going to be for kids younger than that is low. There's not a whole lot of research being done on that age, and we don't want to adversely affect kids who may not be able to fight off the potential problems that a vaccine could cause to kids who are younger than 5.
Okay. Now, on the television, we always hear about COVID, but recently we've been hearing about something called monkeypox. What can you tell us about that? Who does it affect? What are the symptoms? What should we know about monkeypox?
That is that's one of the things that I guess the president even mentioned that in one time. It has similar characteristic. It depends on where it was found and how it was how it came about. There isn't a whole lot of data on monkeypox right now, or that it's just saying that there is a crossover some between animals and human, and that is there are animals that can sometimes, not just monkeys, but animals that can sometimes get a COVID related kind uh, of uh, of effect and spread it, and that's but as far as us seeing any problems with that, or that being a variant or a thing that we're going to see in the United States in any time soon, that it isn't. I haven't seen any effective cases of
Okay.
monkeypox or anything like that. Uh, but yes, there is. They're looking at how other animals or other mammals can be affected by a COVID-like product, and that's what they're talking about.
Okay.
Okay. Okay. Um, what is it that we can do to build a healthier immune system?
Um, we are many
What should
times
we be eating or not eating? And
you should be trying to eat a very balanced diet. You're trying to get the vitamins and minerals, and you're getting the appropriate amount of proteins and rest. All of those things are going to help. Um, as I mentioned to you, because of where we as people of color are from in the world, historically, we have been blocking. We have been with dark skin. We have blocked the amount of vitamin D that has been taken in because we were originally in areas that was very sunny, and vitamin D is something that you can get from sunlight. And so instead of getting a toxic amount of vitamin D, we have historically blotted it out. However, now that we live in an area that does not have nearly the amount of sunlight and coverage, uh, especially in the wintertime, African Americans can get so little vitamin D that it can be a problem. Trying to make sure or get tested, find out from your doctor, is my vitamin D level low? And find out if taking supplements like vitamin C, those kinds of things can be a benefit to you. I would say instead of me trying to give you a list, I would recommend that would be a part of a conversation that you have with your doctor, and find out what would be a benefit to you, because everybody is a little bit different. Find out, they can do some testing and find out what would be beneficial to you, and try to get as healthy a diet with fruits and vegetables. There are many places in our communities and in our world that are considered food deserts. They don't have the fresh vegetables.
Mhm.
They don't have that kind of thing. And kids are growing up eating sugary junk foods. Those definitely, after a while, will decrease your immune system and decrease your ability to fight off any kind of infection. So I would say trying to eat as healthy a diet with protein, and that goes into a bigger issue. Many people say they can't afford these kinds of the diet,
Mhm.
especially the diabetic.
yeah,
There are diabetics that they call diabetic diet, where you're trying to not increase your glucose level, and you're trying to eat healthy and so forth like that. That's an expensive way to eat. It is, but it is the most important way to eat. And so we have to figure out how we can not only help ourselves but help our community to get more of the kinds of foods that will protect them, make them stronger, and boost our immune systems.
Okay. Um, we know it's summertime. Everybody's taking off their masks. They're all enjoying the hot weather. But right behind summer comes the fall, and that flu season falls right in there. So, what can you tell us about what's expected in the flu season that's coming up? And I heard something recently on television where the doctor who talks from the White House, he explained that it would be better to wait and get your booster in the fall because of what's coming in the fall may be more, you might need a better effective booster at that time. What do you think?
Well, there is definitely in the flu season. First of all, you have to understand that COVID, taking your COVID shot does not protect you from the annual flus that we see, and so you continue to need to take your flu shots as well. Now, flu
Mhm.
shots is only kind of generally created to estimate the most likely flu that's going to be coming at you in the winter time. They don't always hit it on the head, meaning the flu shot that you get may not actually fully cover the thing that's going to be more prominent as far as the flus that are coming around. They try their best to make an assessment as to what's going to be coming, and then they do that. Vaccines, like for the COVID, is going to be different. So you're talking about continuing to take your regular flu shot and continuing to take any appropriate vaccines that might be coming out, that might be more directed at the COVID, because it seems to just be going around. And as new different variants come out, some of those variants are going to be more severe than the kinds that we're seeing right now. Everybody's kind of lulled into a situation where they're not seeing as many deaths. They're not seeing as many people getting sick. The ICU isn't filled up with the kind of like they were a year or two ago. They're not seeing the emergency room filled up the way it used to be. So people are beginning to say, "Oh, this is over." Well, it's cyclical, and so there could be, and they are predicting that there will be other versions of COVID that's going to be coming, and especially in the fall, that is going to be more severe and potentially more deadly than the ones that we've been seeing in the last several months.
You
So
think
your
that?
advice, go ahead, Alice.
No, I was just gonna follow. Do you think that's because people are becoming so laxed about it now because the numbers have went down here?
Yeah,
And
I would say that there's a weariness associated with any kind of illness that has lasted for as long as this has. People have gotten tired of wearing their masks. They've gotten tired of the social distancing, or not seeing their friends, or not being that.
Mhm.
It has had a major effect on us. I do mentoring for young people, and I can tell you that there has been a significant problem, especially in the African American community, over the last 2 years, especially during the time when they were going online to do education. If you are a child that has that is self-motivated, and a child that truly wanted to get an education, you could do well in any circumstances. You could do well with the Zoom classroom. But
Mhm.
if you're a child that needs a lot of motivation, and you're
Right.
just sitting there at your home by yourself or with a parent in another room, and you got your foot up on the desk watching, or half watching what's going on there, you didn't learn a whole lot during that year. And that's the problem that we're seeing with these PSAT and SAT scores. They have dropped significantly. And they've
Mm.
dropped significantly because many of our kids are behind, and may
Mhm.
have lost an entire year of education
Yeah.
secondary to having it done online, and
Mhm.
not with the the teachers, and the direct the stimulation that you can get in a classroom is significantly different from
Right.
what you've been doing on the Zoom and when you're in
Right.
your home. Parents aren't able to answer the questions in their math class as to how
Right.
to solve a particular problem. They would
Mhm.
be able to just sit there and talk with a teacher or a teacher's aide or someone, and get the answers that they need in the classroom. You can't do that at
At
home. And
home.
so
That's
a lot of kids get frustrated, and they just kind of turn off. And that will show up in the coming years as far as kids who will have to take remediation courses when they're going to college and so forth because they can't pass the math portion or the science portion, or they can't, or all of that. So COVID has had many, many different problems, and it will continue have a lasting effect that we will see for generations.
Really?
Mhm. Now, what about that booster? Should we take it now or should we wait for the fall? Since you said it may be more severe in the fall.
I don't want to discourage anybody from taking a booster. If they have the desire to go ahead and take it now, I would say take it now, because then that gives you a chance for your body to utilize that booster and possibly make you stronger to be able to fight off whatever is coming in the fall. I don't know if the booster is going to be different in the fall. There, like I mentioned, that there is research being done on boosters and COVID shots that is directed at different areas, not just the protein on the surface, but areas that are non-changing on the COVID molecules, so that they will be able to, regardless of whatever variant comes along, it will be able to say that that same shot will cover it all. Right now, we don't have that kind of vaccine. So especially if you are a person who has low immune system, that you have chronic diseases, that you have MS, you have other kinds of stuff, and are truly susceptible, you need to keep up with the recommendations that the CDC and others are giving, because you are the most vulnerable, and that is why you should go ahead and take the shots when they are available.
Well, how long does the body maintain the antibodies or the immunity after people have been vaccinated or have survived the COVID?
That is definitely a question that we don't have a good answer on. The reasons that they've been giving these boosters in every 6 months or thereabouts, or some period of time, is that indeed it does not last, and it will continue to not. It'll give you a certain level of protection for a while, and then it will wax and wane, especially as new variations come along. So it really won't. It's not lasting, and it's not specific to any. It's weakened as you get to different variations further and further and further down. Different variations can, because of the different protein structure on the outside, can have less and less of an effect. So I can't tell you. I don't know how long it's going to last. That's why ongoing research is being done for this problem.
Dr. Simmons, we have a caller on the line. Her name is Lauren. Lauren, hello. How are you?
Hello. Hi. Excuse me. Hi, ladies, and hi, Dr. Simmons.
Hello.
I want to say hello. I really appreciate the show, and I appreciate you all continuing to talk about COVID. My question is, well, I have several. Well, two. I'm just thinking about the different schools of thought or processes that the medical community and the government tends to put out. It causes a lot of confusion. And I just wanted your opinion, Dr. Simmons, of wearing the mask, and why did they go back and forth like that? Because I do think that's a great preventive measure. Do you think it is a great preventive measure, and should it be mandatory because it's going to continue to mutate and we don't know what's coming down the pike? I'm going to hang up and listen to your answers about the confusion that we get from the medical field and the government and wearing the mask. Thank you all very much.
Thank you.
There is a lot of confusion because our government and the CDC does put out different information. However, wearing a mask will be a benefit to you. There are several different kinds of masks, however, some more effective than others, but wearing a mask can be a benefit to you in decreasing droplet spreading of viruses. The purpose of the mask is that when someone else is talking or coughing or anything in your presence, a shower of little water droplets is in the air, and those water droplets that are microscopic, you can breathe them in, and then if they happen to have COVID, you will definitely potentially get an amount that will possibly cause you to have COVID. So by wearing the mask, you can protect yourself, especially in an enclosed area, inside an airplane, inside an office or a room. That's why the hospitals, even with the recommendations, they still continue to wear masks in hospitals to try to continue to protect their staff, so that they can decrease the number of people that are going to be out sick and potentially weakening their ability to service the community. So definitely, I would say if you're in outdoor situation, I don't think that is as pressing. But if you're going to be in an indoor environment where there's a large amount of people, you can get exposed, and a mask would be a benefit to you, especially if you're immunosuppressed, you have chronic diseases, diabetes, heart disease, vascular disease, any kind of thing that's going to make you, that's going to decrease your ability to fight off infections. You need to protect yourself by wearing a mask in those circumstances.
Okay, thank you. There have been some reports about the lasting effects of COVID. Now, we've all heard the term long COVID, never really quite understood what it meant. For instance, does COVID-19 cause weight loss? Does the sense of smell and taste ever come back completely? What is long COVID, and what do we need to know about it?
There are some people who have had COVID that can have symptoms where they are chronically tired afterwards. They complain of not having the mental acuity and sharpness that they used to have before going into or having that problem. Especially if they had a major pulmonary associated problem where they had weakness and wheezing and their saturation had dropped, even after the COVID symptoms has gone away, they will get tired very, very quickly. Those kinds of things are fall under the category of the long COVID. There are people that have inability to concentrate, and kids in schools have had the same kind of situation after they've had the problem. They don't seem to be able to be as focused and able to concentrate nearly as well as they felt that they could before this process. So those are the lingering processes that can happen after having a COVID effect, and that's what long COVID is attributing to or sensing to. So and they may change. We don't know all the symptoms that COVID can cause, and we don't know what else can happen. People have talked about they having myocardial problems, their heart problems, or pericarditis, fluid around the heart. They can have thrombocytopenia, where you have low platelet count, and that can cause bleeding issues and so forth like that. You've seen patients who've had drooping to one side of the face called Bell's palsy. All of that is, and then miscarriages. That people who've had COVID, they wanted to continue or start a family, and they find out that halfway through the pregnancy they lose the child. All of these are things that that sometimes can be associated, and these kinds of things, disabilities that people have, and sometimes permanent disabilities, are under the classification of long COVID.
Thank you. Dr. Simmons, we have another caller for you. Deneen, are you on the line?
Yes, I am. I had a question, but I was listening to Dr. Simmons explain long COVID, all those things and conditions. Is there anything that people that have had COVID and have the symptoms of long COVID can take to help alleviate that? Or are they going to be living with that the rest of their life?
Sure. Can you have one type of medicine that will solve it? I don't know of any medicines. You can have. There are people who might have Bell's palsy, and they can have steroids that can sometimes help. They'll people who have platelet. See, there's so many different variations and so many different things, and so there's no one medicine that you can take. They can try to treat whatever symptoms that they have. Some people develop severe allergies. I've had people that I known who were not diabetic. Then after they've had COVID, now they're on insulin, or they're taking metformin, or they're taking something because their blood sugar, which randomly started to go up during their treatment with COVID, never came down after they got back. So there are so many different variations and different things. So as far as one medicine, your doctor will try to address whatever the problem is that you're having, but there's no one way and no one medicine that can do that.
Okay. Okay. My original question, though, I was thinking as I was hearing you speak about people, they're hesitant. I have family members and friends that are hesitant from taking the booster yet, and they want to wait. But if I understood you correctly, they would be protected if they took that booster as soon as possible, especially those with like low immune systems and other things. Am I correct in understanding you say that?
I would say that especially those people who have chronic diseases and low immune systems and so forth, they would be of a benefit to do it, because indeed, even though you take a booster, does not guarantee that you won't get the disease of COVID. What it does is it tries to decrease the severity of the disease. And in those people who have chronic disease already, having the booster to try to decrease the severity of the disease will be in your benefit.
Okay, then I understood you correctly, and I hope you're listening. Okay, thank you so much, Dr. Simmons.
Okay. Alice, do you have another question?
Yeah. Some people, Dr. Simmons, have gotten all of the shots and are still testing positive for the virus. So what are some methods that we can prevent us from continually being infected with the COVID?
Okay.
But why, if you get you're getting your shot, so why would you still get the virus?
Again, getting the COVID vaccine does not prevent you from getting COVID. It will decrease the severity of the disease.
Okay.
It does not stop you from getting, I don't care how many boosters you get, you can still get COVID. Hopefully, it is not going to be a very severe process. It will be milder. It may not land you in the hospital. It may not be life-threatening to you. But if you get, that's why wearing the mask is still very, very important, because you can, those droplet nuclei. You've seen people when they're talking and there's water coming up.
Yeah.
Well, guess what? You can see the big drops, but it's the tiny drops that just kind of like a cloud that's in the air where someone coughed or where someone was talking and so forth. And you walk through that cloud, you've just picked up all kinds of stuff.
Okay. Yeah.
Okay, we're starting to run out of time, so I wanted to give you the opportunity, Dr. Simmons. What are the updates? What other information do you want to share with us about COVID-19, about getting vaccinated, and what you've learned over the past 2 years that could be helpful. What should we do?
We as people of color who are have been significantly affected because of the other things that are going on in our life that makes us immunosuppressed and makes us chronically ill and so forth like that. We need to, as we talked about earlier, find ways of boosting our immune system. And you can talk with your private doctor on that accord. Find out what would be best for you, because it's different for many people. You can find out if your vitamin D level is low, if you are not getting adequate of vitamin C in your diet, and you're not eating the right kind of fruits and vegetables and so forth like that. In addition to getting the vaccine, in addition to getting regular checkups and so forth, I would say that would be one a take-home point. The other take-home point is that regardless of what they tell you on the news, that take the vaccine and you'll be Superman and you won't ever get any problems, I am telling you, the vaccine decreases the severity of the disease. It does not stop you from getting COVID. And that is the thing that a lot of people are confused about because of newscasters that have hinted that you need to take this so that would make you impervious to this disease. That is not true. It will decrease the severity of the disease. I know people that have taken all of their shots and 2 and 3 boosters and still get COVID, but that's not it's get a mild version of it. They don't have to end up in the hospital. They stay home for 5 days and recuperate and so forth like that, but they can still get it.
So the shots, the boosters are not, it doesn't cure the disease. It's just tones it down and it's not as severe.
Yes, ma'am. If that's the only thing that I said today that helps, that the people heard, I just want you to hear that. The booster does not stop you from getting the disease. It just decreases the severity of illness.
Okay. Alice, do you have any other questions?
Can you talk a little bit about, what is it called, interferon?
I mean, those back in the time.
I remember back in the 80s when the rumor about the little black boys being killed in Atlanta because black boys were supposed to have the strong interferon, and
interferon can be used for many things. People use it in HIV. They use it for immune type of problems. That was something that was being used to try to help people if they were in the hospital, in the ICU, and showing, getting to the point where they have to, their lungs were so damaged that they were almost having to have a breathing tube put in. That was when interferon was considered one of the choices that they could do to try to help those people who were in a life-threatening situation. You will find very few places and very few hospitals that are even considering. You can come there with COVID right now and be in the emergency room, and they will check you over and send you home with nothing. And that's because the severity of the disease is not nearly considerable. It is not effective. It's not useful right now to give you that for the quality and kind of reactions that we're getting from COVID right now, because it's not nearly as bad a disease as it was before. But that means that there's a lull right now. It could very much be coming back with a vengeance in the fall or winter.
Okay.
Mm.
Well, Dr. Simmons, once again, we are running out of time, and there was so much information you share with us all the time. It's so interesting, and we'd like to keep you on forever, but unfortunately, we can't do that. So, Miss Alice, would you number 34?
Before we thank our guests for appearing on the program again, we'd like to say that Good Health Women's Immunization Networks, Good Health Wins, is our commitment to building an army of good health champions who understand the importance of immunizations across the lifespan. We want to educate, advocate, and impact families and communities across the U.S. to end the pandemic, address health disparities, and shine the light on the importance of good health. Through our network of trusted messengers and grassroots activities, our goal is to increase vaccination rates, help remove barriers, and increase access to vaccines and good health. And Dr. Simmons, you're doing a great job in helping us get the information out to our people and to the public. And I hope the people that are listening, if you haven't been vaccinated, get your vaccination, take care of yourself.
Yeah. And we would like to thank you so much for taking the time out of your busy schedule to inform our viewing audience about the latest information on the COVID-19 virus and the vaccinations. And we also want to thank all of those who tuned in tonight. And remember, our live program is on the first Friday of every month at 6 o'clock. And remember to get vaccinated. And Dr. Simmons, did you want to end with the information that you shared with us earlier about your future?
Oh, yes.
My future. At least I still have much things that I have to do, but I am backing away from my role at the University of Pittsburgh. I am
Dr. Simmons,
retiring to do a few other things other than spending all of my time in the operating room as an anesthesiologist, and so that's going to be a change where I am in the process of finishing out a retirement process.
Well, thank you so much for all you have shared with us over the time. And don't forget, you are still our favorite person when it comes to explaining COVID. So thank you, everyone.
We can still call on you, can't we?
Oh, yeah, you can.
You're not leaving Pittsburgh, are you?
I'll be in and out of Pittsburgh, but Pittsburgh has become my home. I'm going to be in and out, but I will always be available to you.
But as long as we have computers, we can always touch bases with him. Okay.
Yes,
Absolutely.
yes,
Thank you so
yes.
much. And everyone have a wonderful evening. Get vaccinated. Thank you.